All right. Hello, Professor Breckenridge. My name is Libby Burkle, and I did a pediatric case for all-class simulation. It was with a 17-month-old, and she had developmental delay. So the first question was, provide your clinical reasoning across the 5 lines of thought, including strengths and weaknesses. So first, biopsychosocially, I thought that one of my strengths was kind of like empathizing with Lily's mother, because Lily, she is 17 months old and she is only able to walk while holding a parent's hand. So I could really see how that would be, like kind of a burden on your life. Like it's just something that they really shouldn't have to be doing at this point. And I just encouraged her, saying like, I'll do everything I can to help Lily walk. I can understand that's frustrating, that kind of thing. Also, Lily was crying throughout the evaluation, so I comforted her with a toy. It turns out that she really likes sock monkeys, so I took that into account. Also, just the fact that Lily is not walking, it has a huge impact on their family in terms of their family's mobility, because someone always has to be helping her. So I also have to consider that they really want fast results. And they're, probably really frustrated, and they just want to know the reason why. Why is my daughter not walking? So I can definitely understand how they're feeling. Also, so for my weaknesses, biopsychosocially, I didn't really address Lily upon entering the room. It was kind of awkward because obviously, one of the students was acting as a 17-month-old. So I just kind of, forgot that I should be like, oh, hello, Lily, how are you today? And just be really nice to her so she's not afraid. And that would really help her cooperate with my tests later on. So that's super important to consider, and I just did not really remember. So for the E for examination subjectively, I feel like I asked fairly appropriate questions. It was more difficult though because it's a subjective history that we haven't taken before. It's completely different than a regular subjective. So I did my research beforehand and I looked online to see what questions I should be asking. Just in terms of the weeks of gestation, if there's complications during pregnancy, if the child attends daycare, who the primary caregiver is, when motor milestones occurred, so that sort of thing that we normally haven't asked in the past, obviously. So I did that really well. I also was sure to ask an open-ended question about Lily's walking because her walking was impaired. But I wanted to know more about it, so I asked Lily's mom, can you tell me a little bit more about that? So just to leave it open-ended so she can describe her walking style and say whatever she wanted. Also, so for subjectively, or for the examination part of subjective for my weaknesses, if that makes sense, I did need cueing to develop good follow-up questions, Lily's birth weight, her dislikes and likes, so I knew how to calm her throughout therapy. Also, the home environment in terms of what furniture they have available for Lily to cruise on, that sort of thing, I just didn't consider because we haven't really talked about pediatrics yet. So it was just very hard for me to ask significant questions, I guess. For the objective part of the exam, I think I did a good job of observing Lily's gait, and I appropriately identified impairments. I also did a good job of encouraging her to walk. I held a pretend sock monkey because she loves sock monkeys. So I was like, Lily, come walk towards the sock monkey, that kind of thing. Not just, oh, let's walk, because obviously she's not going to cooperate. And also halfway through the gait assessment, I let go of one of Lily's hands because I wanted to assess her balance and see how she did only holding one hand, and I felt like she'd be more comfortable holding her mom's hand instead of just my hand, so I also considered that biopsychosocially. I thought I did a decent job of making it fun. It was a little hard to be creative on the spot, but I think I did a good job. Also, I took her heart rate at the beginning of the O section, which my CI cued me to do, so that was good. She reminded me. For the objective weaknesses, so Lily, she was really supposed to be sitting in her mom's lap, but obviously she was sitting in her own chair. So I couldn't really assess her sitting posture, and I should have asked to see her sit on the floor how she normally would, how she would be comfortable. And that would have been important because that would have provided me with a gross range of motion assessment, because I was wondering during objective how to do range of motion with a child. But my CI told me, oh, like if you would have assessed her sitting posture on the floor and she sat in W sitting, you could have seen that she had really good knee flexion, hip flexion, plantar flexion, that kind of thing. Let's see. I was very unsure of how to test a pediatric child's strength, because obviously I'm not going to do MMT on them. So I needed help to figure out how to accurately assess that, because I was kind of stuck on the fact that I needed to assess each muscle by itself. So I was more focused on like an MMT, like modifying MMT or something like that. But my CI told me all you really have to do is like do a sit to stand and encourage them. Like she said, like blow a bubble and have them like reach up and try to, pop it and stand up. So something like that would have been good. Also we haven't learned the reflexes for children yet. So that would have been really important, because that would have shown me where Lily is at developmentally. My CI said a good one would have been to, like, even though it sounds mean, to make Lily fall. So I would have done it on a mat so that she would have been safe, but make her fall to see if she has that reflex to catch herself backwards like that. Also, she told me that they do balance on a wobble board in the clinic, which I was unaware of, so that was good also. Let's see. Also, to test her strength, I could have had her pull up on a table or like assist her standing up, doing a sit to stand by like pulling on her quads, or kind of like encouraging her from back here more. The objective part was just really hard for me because we haven't done peds yet, but I thought I did a decent job of getting some information. For the diagnosis, one of my strengths was, well, I kind of had the diagnosis beforehand. She told me that I had a 17-month-old with developmental delay, and if I would have asked more about it, I would have found out that she is seeing a neurologist later in the week. So they might be able to help narrow the diagnosis down, but for now I didn't have any more information. Also, Lily's grandmother didn't walk till 18 months, so it could have been completely normal for Lily not to walk at this age either. So considering her family history, that would be normal. Also, I realized I asked about Lily's milestones in my subjective, and I realized that she was not developing as quickly as other children her age. So I kind of pieced that together and found out that her delay was all motor and there was no cognitive deficits. My weaknesses for diagnosis was basically I was really unfamiliar with developmental delay and its causes. I could kind of get an idea of what developmental delay was, but specifically the contributing factors, coming up with those, that was really difficult for me because I didn't know if the condition was due to a musculoskeletal cause or to something greater than that. And it turned out that her delay was only due to weakness, but it was unilateral, and I just didn't really piece that together that it could just be weakness and it couldn't be something greater than that. So I was definitely thinking more complex than I had to for the diagnosis. For prognosis, I provided patient education to Lily's mother, and I told her that Lily will be able to walk independently in 1 to 2 months. Also, since her primary impairment was weakness, I thought that could be developed fairly quickly. But my CI told me that she would have stayed more towards 2 months instead of 1 month, just because in addition to strengthening, Lily also has to regain coordination and motor control. She has to be able to balance while walking because she's kind of unsteady on her feet right now. So those are a lot of components to put together. So I should have realized that it might take longer than I was expecting. For the intervention, my strength was I was really specific towards working with Lily on what she didn't have. So the fact that she always needed to hold on to a parent's hand, I was going to gradually progress that to holding on to one parent's hand. And then I was going to have them position Lily by a couch with both hands on the couch instead of holding on to one of them, so she can kind of gain some independence too. And then I told them, I was like, if you encourage her from one side of the couch and you have a favorite toy or a book or something she likes, you encourage her to cruise along the couch to reach her prize, so to speak. Also, let's see, what else? I think that will help her gain confidence because she will be independent in that regard. And then also I suggested that she perform some sit-to-stands because that's very functional, and although she might not be able to do a ton of repetitions just because she might not cooperate, I feel like doing even a few of those a day would be really beneficial. And also with those, you want to make it a game and encourage her, like, okay, Lily, we're gonna stand up now, but there's like a bubble for you to poke or something like that. Sorry. Okay. So, in my intervention, my weaknesses, I didn't really address her balance specifically. I did in a sense that I gradually, she was holding on to both parents and then one parent and then just the couch, but I didn't really encourage the practicing of static balance, or even if the parent is sitting on the floor, just to have Lily be standing there by herself, So that would be good for them to do at home. Also, she can do the wobble board in clinic. She can sit like a pretzel and then do the wobble board, and that would be really good for her. Also, my CI told me that it would be really good to have Lily use one of those kid shopping carts that they can push around or something like that, so she can be independent, and it'll just increase her ability to walk. And then she said kids at this age also, they love mirrors, so doing sit-to-stands in front of the mirrors would be really good as well. And then my major weakness in the intervention section was just coming up with creative ideas and finding a unique way to work on balance, or finding a unique way to work on strength, because we've only worked with adults so far, and it's pretty standard, all right, we're going to do lunges, we're going to do sit-to-stands, that kind of thing. So I was just kind of at a loss for how to tailor those to a child. Okay, the next question is communication and interpersonal strengths and weaknesses. So my strengths, I thought I did a good job of bringing myself down to Lily's level in terms of how I was talking to her, and I made it fun. I incorporated one of her favorite toys. I was encouraging and very supportive to her mother. I told Lily when she was doing a great job, and I also used layman's terms with her mom, so I think I developed rapport with her mother, and I think the rapport will come more slowly with Lily just because she is afraid of strange people and stuff like that, but I think I did a good job of paving the way for that to happen. For my weaknesses for communication and interpersonal skills, I should have addressed Lily right away, like I said before, so she wasn't afraid of me. That would have helped us gain a relationship, get comfortable with each other. It would have helped me carry out the objective tests, the interventions. Everything would have been a lot smoother if I would have done that. Also, I need to be able to come up with more creative ways to communicate a child and creative ways to motivate a child. So that will be something I need to work on. The next question is physical examination and treatment skills, strengths, and weaknesses. So for my strengths, I was multitasking in the sense that during gait, when I was observing Lily's gait, I was holding on to her hand, I was observing her gait, and I was encouraging her to walk. So even though it was practice, like it was kind of hard to actually look at impairments while I was encouraging her with the sock monkey. So that was, I mean, I did it, like I got all the impairments right, but it definitely took a lot of focus to diagnose the impairments. Also, for a weakness for physical examination and treatment skills, the physical exam was really difficult for me because, as I said before, like we haven't worked with kids, so knowing what to assess and how to assess it was really, really difficult. I knew I wanted to look at strength, but I didn't know how to go about it. I knew I wanted to look at balance, and I did that, but I could have done it in a better way. I was told that active and passive range of motion are not typically performed, and that was something I would have wanted to know, but I was told that in a pediatric setting you just kind of observe and see where they're limited, where they aren't limited, and that will tell you a lot of information. So basically, for the examination, I need to get better at observing, because that's huge in the pediatric setting. Let's see what else. Okay, so the next question is a description explaining how you applied the biopsychosocial model. So I kind of stated this earlier, but I really empathize with the mother, saying, I know it can be frustrating that Lily is not walking, and then telling her, like, I'm confident that I can help her and she will be okay, like she will be able to walk. You just really have to put yourself in Lily's shoes and her mom's shoes, even her whole family's shoes, to see how Lily's developmental delay is affecting their whole family. Their entire lives are affected if they have other kids to take care of. You know, everything they do is going to be slower, and they're at this point where they're like, she should be walking, but she's not, so they're frustrated. Maybe they're scared that something else is going on. But with the information I saw today, I could confidently reassure her that Lily will be okay, she will be able to walk, and I will help you. So that was how I applied the biopsychosocial model. Okay, 2 additional insightful self-realizations, different from above. So the first one is that I have a lot to learn, especially about pediatric therapy. That's where my first clinical is, as I said before, so I'm really excited to learn more, but I'm also kind of scared because I don't want to become discouraged and feel like I don't know anything on my first clinical, so that is what is terrifying me slightly. Also, I need to learn the special tests, reflexes, motor milestones, stuff like that we haven't learned yet. I need to really study. I have notes from an upperclassman from their pediatric course, so I hope to look at that at night and just, get better at that stuff and maybe get a head start in the other class and be able to teach my classmates, stuff like that. Also, I need to learn what questions to ask subjectively and how that's different from a normal subjective history, and then what assessments to do objectively, like I said, how to make them fun, creative, basically make them do objective tests without them knowing they're doing objective tests. And then how to make the interventions fun. And then I also need to learn about different childhood disabilities. So in this case, like if Lily did have something greater, I would need to know what the signs are, what the symptoms are, and how to diagnose that. Also, another insightful self-realization that I had was I feel I did a good job of being open-minded. I was thrown into a completely unfamiliar situation. I was able to think on my toes. I was able to do my research beforehand, be prepared, and I was also not too proud to ask questions. So it just showed me that, I can be thrown into a situation and I can work my way through it. So I guess that increased my confidence for clinicals. So that was good, and it felt good to have the first unfamiliar situation under my belt and to learn from one of the other girls who went to the same clinic. And also from the video, I learned that I play with my hair a lot, so I should really work on not doing that or put it in a ponytail. Okay, that's all I have, I believe. So thanks for listening. Bye.